So if you've ever been at home folding laundry, doing something with the TV in the background, and you hear a Medicare commercial come on and an aging sports star or celebrity tells you about this amazing Medicare plan where you don't pay anything. In fact, we're going to pay you. And when you sign up, you get a free gym membership and a flex card. And tomorrow morning, there's going to be a pink Cadillac in your driveway. That's people marketing Medicare Advantage plans. And so one mistake is to never, 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 never enroll in an Advantage plan on a 1-800 number that you saw on a commercial.
Hey y'all, this is Kosta, and today I'm here with my guest, Danielle Roberts, co-founder of Boomer Benefits and author of 10 Costly Medicare Mistakes You Can't Afford to Make. Throughout her career, Danielle has personally helped thousands of beneficiaries with their plan decisions as she specialized in Medicare-related insurance and became a member of the prestigious Forbes Finance Council. Danielle, to start this episode, would you give us a brief overview of Boomer Benefits and tell us a bit more about how you became a Medicare expert?
Sure. So I started with my insurance license back in 2004. And like many agents who come into the health insurance field, I started off selling individual health insurance and group health insurance products. And over time, we had those people coming back to me to ask, could I help their parents? Because they were trying to help mom or dad figure out the Medicare, and Medicare was really confusing. So we got that request a number of times before we finally said, okay, let's take a look into see why is Medicare so confusing? Is it really as complicated as everyone is letting on? And we found that it is absolutely overwhelming for people. You come into Medicare and you have multiple parts. There are 10 different Medigap plan options. Today, now after 2006, now we have thousands of drug plan options, hundreds of Medicare Advantage options. And people are almost stunned into inaction when they first get onto Medicare because that is so overwhelming. And so we just set out to make that process easier for them. We help them navigate their entry into Medicare. We teach them about the basics that their federal government benefits already provide for them so that they can get a foundational knowledge of what kind of plan do they need to add on to that meets their needs, their budget, lets them see their providers. And our agency just grew from there. Today, we are in Fort Worth, Texas. We service people in 49 states, and we have about 100 employees. So it's been a really good ride.
Well, congratulations. And we're going to get into all the aspects of Medicare because you are right. It is very confusing. So with that being said, the confusion around Medicare and its various parts, would you break down the different aspects of Medicare for our listeners and explain their function?
Sure. So Medicare, original Medicare, or what we call traditional Medicare, has two parts. Part A and Part B, because Medicare back in the 60s was modeled after the old Blue Cross and Blue Shield style of plans. So Part A is your hospital coverage, Part B is your outpatient coverage. This really shouldn't be that confusing because if you think about your current insurance that you had when you were under 65, you enroll, you have coverage in the hospital, you have coverage as an outpatient. You're going to have exactly the same things as Medicare in that regard. You also have two optional parts, and that's where things start to get a little trickier. You can decide to keep your benefits through the federal government on Medicare Part A and B, or you could choose to get those benefits through Part C, which is a Medicare Advantage plan. So these are optional, and you can enroll in a Medicare Advantage plan, and the insurance company operating that will give you all of the same medical services that A and B covers, but it'll be through a local network in your area. And then in 2006, they updated Medicare with Part D, which is voluntary outpatient drug coverage. And so if you don't have other drug coverage through an employer or through the VA and you want some help with the cost of your outpatient prescriptions, you would pick up a Medicare Part D drug plan. And some people who enroll in the Part C Medicare Advantage can get the Part D rolled into that. So you can already see that when we start just with the four parts of Medicare, how tricky that is. And for people to be looking at this who all their working lives, an employer has chosen their health insurance for them, Now they have to learn a federal government national health insurance program, choose the parts to enroll in them, figure out when to enroll in them so they don't have penalties, and then figure out what to add to them so that they have robust coverage. And that's where all those parts and plans can sometimes just be really overwhelming for someone new to Medicare.
Is there a Part E coming soon?
Let's hope not. We do not need any more parts.
So one of the most common Medicare mistakes people make is missing their initial enrollment window. Will you explain the significance of this window and what happens if someone does in fact miss it?
Yeah, you would be surprised. You would think that most people would know that at age 65 you enroll in Medicare, and yet there are over 1 million people every year that totally miss their initial enrollment period because they just didn't understand what it is. Social Security and Medicare have done some things in the last few years to update that, and they're sending out additional information in the mail to alert people, make sure that they're looking at this as they head into age 65. But that initial enrollment period is when you should enroll in Medicare if you don't have other creditable coverage, such as through a large employer that you're maybe still working for. You have a personal 7-month window that starts 3 months before your 65th birthday, goes through your birthday month, and then runs for 3 months after. And as long as you enroll in Medicare Parts A and B in that window, you don't have to worry about any late penalties down the line. Now, it does get tricky for people, though, because sometimes they might still be working. And so they, depending on the size of their employer, they could delay that Medicare until the time that they retire and then add. But that also gives them a shorter window to add that on the back end. And if you get it wrong, you can end up with penalties that you really shouldn't have had. And so it's important for people to know that they need to initiate their enrollment into Medicare within that 7-month window if they don't have any other coverage, especially if it's going to be their primary coverage. That's going to be really important. Now, one group of people get auto-enrolled into Medicare, and that is people who start their Social Security before age 65. So you're eligible for Social Security benefits as early as 62. And many people today delay the Social Security benefits until their full retirement age or until 70 to get those delayed income credits and make that Social Security check bigger. But there's also an opposite school of thought, which is I've paid into this program all my life. I'm going to get my money as soon as I can. And so if you're one of those and you sign up right at 62, my dad was one like this, you need to make sure to check your mail 1 to 2 months before you turn 65, because they are going to assume that now that you're turning 65, you need Medicare because they think you wouldn't have enrolled in Social Security benefits if you were still working. So if you start Social Security before Medicare, your Medicare card will just show up in your mailbox 1 to 2 months before that 65th birthday. But if you delay enrollment into Social Security, then you need to initiate your own enrollment into Medicare during that 7-month window. And you can do that 2 ways. It's very easy to go online to ssa.gov and sign up for Medicare. It will take you probably less than 5 minutes. It's very easy to do. But we're sometimes running into people that are more old school and they want to go down in person to their local Social Security office, and you could certainly do that as well.
That's great. And so just to clarify, if you're currently working, you don't need Medicare, especially if you have an employee-sponsored plan, right?
If you work for a large employer, that is true. Okay. So if you have 20 or more people and you are actively working, you're not on COBRA, but you're actively still working, that insurance is going to be primary and Medicare is secondary. So in that scenario, you could delay Part B, you could delay Parts A and B, depending on how much coverage you want to have coordinating with your Medicare. But if you work for a small company with less than 20 employees, Medicare is primary and the group coverage is secondary. So in that scenario, we recommend that you enroll in both Parts A and B because there's no guarantee that that secondary coverage is going to pick up the 80% that Part B should have covered for you when you never enrolled in it. So that's employer size is important. And where people run into problems with this is their friend who works for a large company meets with someone like myself and my team, and we tell them the rules, and they go ahead and get all signed up. And now Sally tells Jane, who works for a small employer, oh, if you're still working, you don't have to do anything. And Jane actually did need to enroll in Medicare Parts A and B. So, of course, all the reasons why you want to start your research early and work with a reputable agent who handles these things, who can help you avoid the pitfalls, just like this one that would be so easy for people to stumble into.
Are there other common mistakes when people are enrolling in Medicare or, say, selecting supplemental coverage? And how can they avoid some of these mistakes?
Yes. In fact, there are some mistakes that the people new to Medicare make over and over and over again. And ultimately, I wrote a book about it. So my book is 10 Costly Medicare Mistakes You Can't Afford to Make. And this came from years of me and my team watching people coming into Medicare at 65 and screwing up certain things that were just so easy for them to mistake. For example, many people think that Medicare is free. So they never saved up the money and they get ready to retire and they find out they have to pay for Parts B and D and that they'll also need supplemental coverage or an Advantage plan. And we've had people who have chosen to continue working for a while because they didn't put away enough money for the cost of health care and retirement. One of the other things that you will see people do is they will assume that if they enroll into a Medicare Advantage plan, that they don't have to pay for Part B anymore, and they'll cancel their Part B, which makes them ineligible for the Advantage plan, and then they get booted out of everything and they wonder what happened.
My gosh.
Now they're going to have to enroll late during the general enrollment period and probably be subject to a penalty. So we looked at all of, at Boomer Benefits, we have a client service team that is dedicated just to the policyholders that we service, and we help them through everything on the back end. And we just looked into what kind of calls were we getting on that team from people that were new to Medicare who had just made suggestions, and then what kind of calls were we getting about errors on our sales team where someone did try to do it themselves, made a mistake, and then reached out for an expert to help them. And we just took that list of those mistakes and determined which 10 of them were the most common and most costly. And then we put a book together just to get the word out there and help people understand that you do need to do a little research before Medicare. You don't want to skate into that when you're 64 and 364 days in. It takes a couple of weeks or months to learn all of your options. So if you have time to start early, that's always my best suggestion.
And pick up your book and read it so you can actually do the research, right? Absolutely.
Yes.
You mentioned penalties, and I'd just like to really understand, what are the ranges in these penalties? Are we talking about hundreds of dollars? Are we talking about thousands of dollars? Tens of thousands?
Well, for Medicare Part B, Medicare Part B, hopefully you can edit that out. Let's say that over.
Sure.
For Medicare Part B, you have a base premium of $164.90. Could be higher based on your income. Okay. So
that's a month.
That is per month. That's right.
Okay.
If you fail to enroll in Part B when you were first eligible and you don't have that other creditable coverage, then you could be in a world of hurt, because for every 12 months that you are not enrolled and you should have been, they're going to add a 10% penalty to that Part B premium. So I have seen people come to us at age 72 who had been working for a small employer or making a mistake. They didn't enroll when they should have, or they were just healthy and just decided they didn't want to pay for Part B. Now they want to enroll. Not only do they have to wait until the next general enrollment period to enroll, which could delay their coverage and leave a gap in coverage, but they're also going to have a penalty. We had someone that was 72 once that contacted us, and he was paying a 70% penalty on his Part B simply because he had zero idea. He was a very healthy guy and he didn't realize. And so for the rest of his life, he ended up with that penalty. And there are also penalties for Medicare Part D. So while it's supposed to be voluntary, in my book, we call it optional, sort of, because if you don't enroll in Part D and you don't have some other form of creditable coverage, they're actually going to assess a penalty there too, and it will be 1% per month of the national average premium for every month that you didn't enroll. So let's say you wait 5 years, now you sign up for a drug plan and it's going to cost you 60% more for the rest of your life. You pay that penalty every month on top of your premiums. And of course, they implement the penalties to hopefully make people know how important it is to get enrolled at the right time.
Right.
But there are 65 million people out there who are doing this, usually on their own. Once a year, they're making decisions. They make these decisions up front. They don't know the rules, and it's very easy to stumble into a penalty and then have to pay that. And then, of course, that's very upsetting to them.
Oh, absolutely. And then on top of the fact that they thought it was free to begin with, right?
That's right. And if they did think that, then they're really upset. Yeah.
Right. Yeah. So let's talk about Medicare Advantage. As Medicare Advantage plans continue to grow in popularity, I'd like to hear your opinion on the pros and cons of these plans compared to traditional Medicare with supplemental coverage.
Yeah. So if you've ever been at home folding laundry, doing something with the TV in the background, and you hear a Medicare commercial come on, and an aging sports star or celebrity tells you about this amazing Medicare plan where you don't pay anything. In fact, we're going to pay you. And when you sign up, you get a free gym membership and a flex card. And tomorrow morning, there's going to be a pink Cadillac in your driveway.
Yep.
That's people marketing Medicare Advantage plans. And so one mistake is to never, 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 never enroll in an Advantage plan on a 1-800 number that you saw on a commercial. Those commercials right now are actually being addressed by the Senate Finance Committee for being so misleading. They will advertise benefits that the average beneficiary doesn't even qualify for unless they have Medicare and Medicaid for very low income. And so when you get on the phone, they're going to say, oh, you don't have Medicaid. Well, you don't qualify for this $900 flex card. But if you sign up for this plan over here, you could get $50 once a quarter to spend in our over-the-counter benefit catalog. And maybe they don't check to see that their doctors are in the network. Maybe they don't check to see that the plan covers the medications they need on the formulary. They don't have any idea that they are limiting themselves to a network of providers. They don't understand the differences between an HMO and a PPO. They're just getting a hard sell on a 30-minute phone call. So I want to make that point first because that is how Medicare Advantage plans get a bad reputation.
Right.
However, if you use them properly and you understand how they really work and you work with an agent to find a plan that meets your needs, Medicare Advantage plans do have their place in the market. So not everyone can afford a Medicare supplement. A Medicare supplement might run $100 a month, and in some states might be over $300 a month, depending on the cost of living in those areas and the cost of medical care. And so they came up with the Medicare Advantage plan options to give people something less expensive, but that will also help hedge their risk, right? So when you enroll in an Advantage plan, Medicare pays the Medicare Advantage insurance company to take on all of your medical risk. And they pay them over $12,000 a year. So if that insurance company can get you to enroll and then deliver your health care for less than what they're being paid by Medicare, they will profit. And they make enormous profits. If you've ever looked at like United Healthcare stock,
I
it's
have.
just through the roof.
90% of their income is from government spending.
Yes, and we see all this venture capital now getting into Medicare as well because there's so much money to be made there. So people will be very excited about a plan where they can have such a low premium. So Medicare Advantage plans, because they're getting paid by Medicare, often they will set their plans either with a zero premium, meaning you don't pay anything for the plan at all except for what you're already paying for Part B. Or maybe there's a plan that's $10 or $50, and so they're cheaper than Medigap plans, but on the back end, you're going to pay for services as you go. So if you're someone that joins a plan that has a $50 specialist copay and you see the specialist twice a month, you may not be saving anything on that Medicare Advantage plan. In fact, it might have been better for you to go the Medigap route. So a lot of healthy people choose Advantage plans because they're not using as much, and so the pay-as-you-go is not a burden for them. But we need to think about health insurance for the times when we really need it. So what is this plan going to provide me if down the road I get sick and I have cancer or kidney failure, what am I going to pay in that scenario? When you join that Advantage plan, a good agent will go over the summary of benefits, which shows you exactly what you'll pay for doctor copays, prescription copays, MRIs, CT scans, ambulance rides, hospital stays. And you need to look at that and say, can I afford that if I develop this kind of health condition? If I go in and an MRI is going to cost me $200, can I afford that? And if the answer is no, you might be better off to do a Medigap plan where the premiums are higher, but there's very little spending on the back end. And so my opinion about Advantage plans is that people just need to be more educated on them, to make sure they do their research up front, to know what the risk might be in the event that they have a year with a lot of health conditions going on, and then also have a rainy day fund. Take that money that you would have paid into the Medigap plan and put it into a medical account that you never touch until such time that you need it for medical. Then if something happens and you go in the hospital down the road, you're not panicking about what kind of bills are going to come in the mail because you've already set some money aside for that.
Yeah. I have two quick questions following up on this. So in your opinion, if you can pay for Medigap, is it better than signing up for a Medicare Advantage plan? Like, let's just say that money wasn't the primary issue. Is it better to be on a Medigap plan?
I wouldn't say that it's better. I would just say that it's different strokes for different folks. However, I would also tell you that my dad is in a Medigap plan. And the reasons why we chose Medigap for him and why I suggest this, of course, my team suggests it to many people, is the freedom of access. So if you stick with original Medicare and you add a Medigap plan on the back end, you can see any Medicare provider anywhere in the nation. There's over 1 million approved providers. You don't need a primary care doctor. You don't need a referral to see a specialist. You're going to be covered whether you're in Maine or California or Washington, Florida, or anywhere in between. And that freedom of access is really what you're paying for. And then with a Medicare supplement or Medigap plan, same thing, just two different terms. Medicare pays their share, and then they send the rest of the bill to your Medigap company, who pays their share, which would have been your share if you didn't have it. And you only get a bill if there's anything left over. So there's a lot of peace of mind in a plan such as like a Medigap Plan G or a Plan N, where there's actually not a lot of out of pocket for you. You're going to pay more in premiums, and you're going to have rate increases from year to year, just like any other kind of insurance. I got my homeowner's insurance bill increase this year and used to paying that going up a little bit. So you do have to look and see, can I afford this now? Can I afford it in the future if the premiums are going up some, compared to what you would spend with Medicare Advantage? And then ask yourself the question, how important is it going to for you to be able to see a doctor if you go to Kansas to visit your grandkids and you're out of network with your Advantage plan? That's where Medigap makes everything so easy. But 50% of people do choose the Advantage plans, and that is mostly about the premiums and the extras. Medicare Advantage plans will throw in things like a gym membership, or we talked about the little flex card. They'll put some money on it. You can use it to buy vitamins and supplements through their store. Some of them even advertise cards with a grocery benefit. Well, is the grocery benefit more important than you taking care of the big thing that might happen to your health 5 or 10 years from now?
Right. And so on that note, 5 or 10 years from now, let's talk a little bit about long-term care, because I have been seeing the commercials and Medicare Advantage is saying, we'll pay for sitter services or non-medical home health care a few hours a day, whatever it might be. So how does Medicare fit into the picture when we're researching long-term care payment options? And what are the specific limitations or gaps in coverages that we should be prepared for?
Okay, so with original Medicare Part A and B, there is no coverage for long-term care.
We should say that again.
Yes, there is no coverage. This one really confuses people, and especially if mom and dad go into long-term care and the child has to pay for it because there's nothing left. They may have to do a Medicaid spend down. Medicare doesn't cover long-term care, and long-term care is very expensive. What Medicare does cover is short-term care in a skilled nursing facility for up to 100 days when you've had a 3-day qualifying hospital stay up front. And at 100 days, it's done. You're booted out of the rehab facility. In fact, sometimes they'll boot you out earlier if they don't think you can pay, because Medicare only covers the first 20 days in the the long-term or skilled nursing facility at 100%. After that, you start paying a daily copay, which is currently $200 a day, goes up a little bit every year. It can get really expensive. And the skilled nursing facility is designed for people who are recovering from an injury or illness and are getting better and will be able to return to independent living and caring for themselves. Well, if you go in skilled nursing and you have dementia and everything is going downhill, now you need long-term care or assisted living, a nursing home, and Medicare just doesn't pay for that. So a few years ago, they made some changes to that. Medicare Advantage plans can now build in some supplemental in-home support kind of care. So you might be able to have the bathroom grab bars installed and your Advantage plan would pay for it. They might have 1 day a week of adult daycare or a couple hours, like you said, per month of some in-home care, but it's still not going to cover you when the need becomes full-time. And most of us at some point are going to need a caregiver. So it is important in my view that you still purchase long-term care insurance. My parents have long-term care insurance. In fact, I pay for my mom's premiums for her because it's so important to me that she has it, and to make sure that she doesn't have to worry, and also to make sure that I would have help because that care is going to fall on me at some point. And I want a policy where I can make sure she has someone in the home to take care of her, or when time comes and she needs help moving into a long-term care facility, we've got that covered for her.
How long ago did you purchase the long-term care insurance policy, and how old was your mom?
We purchased it probably 10 or 12 years ago, and she is 71 or 72. So we bought it at a time when it was pretty affordable. There's been some rate increases over the years. I think we pay something like $370 a quarter for a 5-year long-term care plan with an inflation rider and all the bells and whistles. As you surely know, the older you are when you buy it, the more it's going to cost you. So this is something that right at 65, if you haven't already taken care of that when you're coming on to Medicare, I would be making your Medicare decisions and your long-term care decisions. And if you can't qualify at that point for a long-term care because of a health condition, you need to be putting away some serious money for the eventual possible need that you would have to go into long-term care.
Absolutely. And we usually tell people on the show that they need to start really considering long-term care insurance between the ages of like 45 and 55.
Yeah, I agree.
Because I feel like the sooner that you can, exactly. And the sooner that you can get enrolled, you can start, it's kind of like life insurance, term life. It's the same concept. I just wish more people took advantage of it. But I keep hearing this common occurrence of, it's too expensive. It's too expensive. But, as you explained, it's only $370 a quarter. I mean, that's maybe a little over $120 a month, right?
Yes, and considering that when you go into long-term care, you might spend anywhere from $3,000 to $10,000 a month.
Right.
The claims that are filed are so huge on the back end that they need to have a lot of people paying into these policies so that they can afford those. But when the premiums go up, it means those claims are happening. People are using those benefits. I think statistically, more than 1 in 2 people will need long-term care at some point. And so you can't buy that kind of insurance and think it's going to be $20 a month. Like, it's a significant investment. But if they sign up for it when they're young, like you suggest, so you're still in the sort of middle age, the premiums would be a lot lower.
Right. And so I think we should consider long-term care as an inevitability.
I agree.
Is the best way. So you've helped over 50,000 beneficiaries navigate their journey with Medicare. If you could give one piece of standalone advice to someone about Medicare and how to get the most out of their coverage, what would it be?
So the thing about enrolling in Medicare is you can't take it lightly. You have to make this a serious project. Start learning when you are 64 or 64 and a half. Go to our website and sign up for a Medicare 101 webinar. They're free. Go to YouTube. Boomer Benefits has a channel. If you want to see yours truly, I teach a lot there, but there are also several other great channels there. Go to Medicare's website, medicare.gov. Do some reading. look online. There's a Medicare and You handbook. You should study that thing and really understand, get a good feel for what your original Medicare benefits provide you so that you will have a better understanding of what gaps you need to fill in and begin to get a sense of whether you think Medigap is a better fit or a Medicare Advantage plan is a better fit. And that's a single best piece of advice I can give people is don't wait until it's too late, because that's when the stress is so high when you're trying to make these quick decisions and there's all these moving parts and you haven't had an opportunity to just slow down and learn what those are. You need to give yourself enough time.
So we always like to end the show with a call to action. What's the best way to stay updated on changes and developments in Medicare benefits?
Well, one good thing is there's a lot of attention nationally on Medicare right now. There is much discussion in every presidential election, so we do have news out there about it. But you also need to be connected into a place where you can get Medicare news from your peers and from people who know what they're talking about. So I would recommend people come on, if you have it on Facebook, you can look up our page, Boomer Benefits, and from there, you can join our Facebook group, which is free, and anyone can join who is a Medicare beneficiary. So it's not just for our clients. You can go in and join us. We have almost 50,000 members in there, and one of the things I love about our community is in the very beginning of the Facebook group, it was me answering all of the questions, typing into the wee hours of the morning. But now I have a whole marketing team and we manage hundreds of posts in there every week. And people can ask all the questions they want to ask. And sometimes our members will answer the question for another beneficiary before we even get a chance. So I love to see the camaraderie and the people, Medicare beneficiaries helping each other. It's really fun to watch that. But that's a great place to go and start asking the questions, start asking those questions. And then for sure, attend a webinar, Medicare 101. You can sign up for that at boomerbenefits.com. And I break down the whole thing in about 60 minutes, and then we have a Q&A session at the end. That's a great way to just get your feet wet, and then you'll of course do some studying and asking questions on from there until such time that you feel you have a good enough handle on it that you can make some decisions.